Hello there, my name is James Bond. I'm a health and fitness expert, and I work with people who want to improve their quality of life, particularly those who want to lose weight. And today I'm going to talk about one highly controversial issue, especially in light of the case of Sherma Turner. And that is why so many NHS workers are overweight. Because if you look in the National Health Service and look around, you'll see loads of overweight nurses, worse still overweight doctors, and so on and so forth. Okay, and why is that the case? Well, let's go through them. It's really, really simple. First of all, disposable income. Let's face it, although there have been cuts in the National Health Service, doctors are still relatively well paid. So if you think about it, they can afford to eat the luxurious food, the rich stuff. Okay, but it's more fundamental than that. Obesity is largely a disease of poverty. And let's face it, medical students, nursing students, all NHS students live in what I call a state of pseudo-poverty. How to explain this? In 1998, I wrote a paper on student debt, and I predicted back in 1998 that by 2010, a student who graduated from university who had no parental funding would be £35,000 in debt when they finished. And I was called a loony, and sadly that proved to be the case. You see, I predicted in those days that this would lead to graduates not buying houses, and this would ultimately lead to a recession in the housing industry, which would lead to a knock-on recession for the rest of the economy, causing recession. I was called a loony and proved to be correct. So basically, obesity is a disease of poverty, and students who are in NHS professions live in what I call pseudo-poverty, in the sense that they're very, very poor when they're students, but when they graduate, they will have relatively stable income. For the first 10 years or so, they're going to be paying off quite a large amount of debt. So there is that. Basically, people who are poor can't afford quality food, and unfortunately, that is very much the case. Let's go through some basic things, though. Sleep deprivation. Well, junior doctors are well renowned for not having enough sleep. When I was a junior doctor, I would have to do a week of nights every so often, and that would mean 7 nights of 8 p.m. to 9 a.m. And trust me, when you've done that for 7 nights, you are very tired at the end, and you do not want to be making your own dinner. You're too tired to do that. And any catering arrangements while you're there? No, absolutely not. The hospital catering canteens don't exactly serve the best food in the world. And what we had to do very often, we had to call in for pizza. I didn't. I got myself a packed lunch, but that's basically what happens. Okay, as well as that, hospital food, it's basically garbage. Okay, uh, I've gone into many hospital canteens, and they are quite politely garbage food. I wouldn't give my dog the food that they give in hospital canteens. Other thing is, in hospital, very often you have grand rounds, and drug company reps in those days, although less frequently now, would treat doctors and ancillary staff to some very luxurious dinners, and sometimes give you alcoholic drinks, where basically alcohol was free flowing. Again, that's going to contribute to obesity among NHS staff. Okay, then there's the issue of stress. NHS work is largely very stressful, and part of the reason for that is the incredibly poor organisation of the National Health Service. When I used to work as a house officer, it just begged belief how disorganised they were. I mean, I used to work on one ward, and it was unreal. I used to come on in the morning, and before I knew it, 5 nurses had come across me and said, "I need this doing, I need this doing, I need this doing," and they didn't prioritise anything. I worked on another ward, and it was completely different. The nurses would go round, do their drug round, and basically what would happen is to make a list of things and let me get on with them. After a while, I beat the system. What we did was we got a book, 2 pages for every day, and what we'd do is I'll predict what jobs need to be done. For example, if you had a prescription, what I would do is, let's say your prescription ran out on Friday, I'll put a note in the system to write it on Thursday. Cut out a lot of stress, okay? But the NHS is so disorganised People get stressed, and so what happens in any environment, people are stressed, they eat badly. Okay, access to means I've discussed. Meal breaks. Well, this I think is absolutely atrocious. In in hospital, they don't give their staff meal breaks, and I always recommend half an hour to have your lunch and eat slowly. What do they do in hospital? Well, junior surgeons are renowned for basically only having 10 minutes in between patients, and they have to wolf down their food, and that's really, really, really stupid. And last but by no means least, a lot of NHS staff, and this is unfortunately it's unavoidable, district nurses, paramedics, and so on and so forth, they have to do home visits, so they spend a lot of time in their cars, very little access to good catering. So those are some of the reasons why National Health Service staff can actually be obese. They can be addressed, with good organisation. They can be addressed with proper catering, and they can be addressed by basically thinking long term. But I can tell you here and now, the NHS will never change. My name's Bond, James Bond, and I hope this talk has been shaken but not stirred.